Okay, thanks everyone for showing back up after lunch. That's always a good sign. We wanted to take just a few minutes to talk a bit about some state and regional perspectives on public health workforce planning. I mentioned at the outset of the day that the Workforce Development Coordinating Council is exploring what a statewide workforce development plan would look like. So obviously, having statewide goals for what it is that we hope to achieve for the workforce in Kansas would more than likely be a very good thing, building on the work of the council. Without goals, it's pretty difficult to know where we're headed and when we know when we get there. So we think goals would be something that will be really important to advance the workforce efforts. We are partners, Kansas being the we, with other Region 7 states in workforce development efforts in many ways, ways that go beyond simply planning and delivering training. And we were very happy that our partners from the Midwestern Public Health Training Center were able to be with us for the forum. So I'd like to ask Lori Walkner from the Training Center if she would to come up, and she's going to introduce our next presenter.
Thank you, Shirley. I'm really happy to be here today and brought along our group of 2 people from our training center. We're one of 10, as Shirley said, one of 10 regional public health training centers. We've been funded for since 2001, so a long time. It's funded by HRSA, but it's gone through several iterations, and now instead of having 37 public health training centers across the nation, we're down to 10 regional training centers who have partners, academic partners and practice partners, to do the work of the training and the assessments and the evaluations, and training also the emerging public health workforce. And so as part of some of our efforts that we've done this summer in Iowa, we offered an internship with our Iowa Public Health Association. And the work to be done was we're not like you guys. We're not as far along as you guys are. We don't have a workforce consortium or collaborative, a statewide one. We're kind of all intertwined somewhat, but we are working together now with our Public Health Association on pulling assessments together and then trying to get a group together to form a consortium and start this work collectively, because we know that we all have lots of resources to leverage and really push the envelope in training and education and workforce development. So that's kind of what brought us to where we are today. Aaron was an MPH student. He graduated in August, so go Aaron. And he was the one that got the internship for this summer. So he's going to talk to you a little bit about some of that work and the things he did to lay some of the ground plans. So Aaron Reinke. Thank you.
Thank you, Lori, for that introduction. I actually just started working in workforce development not too long ago. It was about 4 months ago. So 4 months ago, I really had no idea what workforce development was. I maybe had 1 or 2 classes in workforce that even mentioned it. So I got that email that there was an internship available for workforce development, and I thought, well, that would be a universal skill because everywhere has a workforce, right? So I applied for it and I got it, and they sat me down and they talked about what the outcomes were for that internship, and that was the creation of a statewide workforce development coalition. And there was 2 things going through my mind at that time. It was one, wow, I'm a part of a statewide initiative. This is a lot bigger than a local. This is a huge kind of thing coming together. And second, what did I just get myself into? It's 5 minutes ago, I didn't even know what workforce development was, and now I'm creating a statewide coalition. So that was a good journey. So thankfully, it wasn't as hard as what I expected. So it was just 3 parts. A report of the national findings, and that was a lot with the PH wins. Second is creating our own survey, and then third is creation of the Workforce Development Coalition. So what we found from the report was the main thing was that Region 7 had the most perceived skill gaps overall across the other regions. And we also noticed that, like they said earlier, that 25 full-time employees were needed in order to be a part of that local health departments to be surveyed. So we wanted to have a little bit more people involved, and also not just health departments, but reach out to the private sector as well to have a voice for everyone in the Workforce Development Coalition. So we created our survey based off of the PH Wins questions, and we almost copied and pasted them. So before you sue me for plagiarism, we did ask for permission. So yeah, so instead of using the Likert scale like you guys use, we used a rank order because we wanted to have it a quick survey and get generally the same information from the survey as PH Wins was, but make it quick so the workers who have that 40-hour week can still take that 5 to 10-minute survey. And we hope to get some information to build a foundation for our Workforce Development Coalition and decide who will be a part of that coalition in the beginning. So right now, the survey is going through IRB approval, so we don't really have it yet, so we don't have the information, but once it comes back, we'll be able to form that coalition. And through this whole process, I actually have been applying everywhere, so I actually just got my epidemiology job in Black Hawk County, so I'm happy, and I'm hoping to bring workforce development to that epidemiology.
Great. Thank you. I just met Aaron probably about that time that he started, exploring the workforce development effort in Iowa. And I was so impressed because I thought it was very, very cool to see an emerging public health leader taking on that focus, taking the big bite of looking at how do we do something big picture that can impact the entire workforce in our state. So kudos to you and good luck in the new job in Black Hawk. That's going to be awesome. Yeah.